My name is Todd Hicks, and this is my iFuse story. My back pain started 14 years ago. I know the moment it started, I was teaching tennis. I was teaching a group of tournament juniors, and I was demonstrating a big kick serve that I wanted them to learn, and it was the last moment that I ever taught a tennis lesson. I felt a snap in my low back, what turned out all these years later to be my SI joint, and I hit the ground, scared the kids to death. I then journeyed down a road for 14 years of one doctor after another, one orthopedic, one chiropractor. I tried it all. As my back continued to deteriorate, it actually was starting to hurt to receive chiropractic care. I tried injections up till the last 2 or 3 years, and injections may last hours, where they used to last weeks. The majority of my pain was in my right groin, it was in my sacrum area, it was in my low spine, and then I had pain shooting down my legs. Sciatic, terrible sciatic pain down my right leg, numbness in my right leg. It was a 14-year journey of horrible pain, chronic pain, debilitating pain. I was not able to do the things I enjoyed doing. So unfortunately, my daughters and my son didn't get to enjoy the young years with their dad. So on one of my many sleepless nights, about a little over a year ago, a few clicks on Google, I found iFuse. I'm like, what is this? And then I started reading and researching and realized, oh my goodness, there's my answer. This is my answer I've been looking for. After 13, 14 years, this has got to be my answer. I have all of these conditions that are laid out on the website here. Then I started looking and listening to testimonials. Through my own research, I found Dr. Logging.
Hi, I'm Dr. James Logging. I'm an orthopedic surgeon with Palmetto Bone and Joint. We have offices in Clinton, Newberry, and Chapin, South Carolina. I'm a general orthopedic surgeon and specialize in SI joint fusion. The SI joint is located basically on the back part of the pelvis. It's where the spine meets up with the pelvis, and so that's the sacroiliac joint where the sacrum meets the iliac wing. So one thing with Mr. Hicks is that when he came to see me, I mean, he had been to multiple physicians to that point and had multiple injections for his back and in the SI joint as well. He had researched the problem pretty extensively and took it upon himself to find surgical options or options to help treat that pain, which led him to me. He was very excited about the possibility of SI fusion to try to help get past that pain that nobody else could seem to get rid of for him.
So I walked through the door with the hopes that Dr. Logging would diagnose me with SI joint dysfunction and that he would highly recommend that I'm a candidate for iFuse. Because with all of my research, I knew that I was, after watching all the testimonials, reading all of the histories of the patients who had prior experience with iFuse. I knew that I was a candidate, and I was just praying and hoping that Dr. Logging would see it that way, and he did.
If conservative management fails, and we've tried all of these other options, then surgery with SI fusion is probably the best option.
So Dr. Logging recommended surgery. I was so excited that day. It was just the day I've been waiting for. After all the research had gone in, after my personal research, after the evaluation from Dr. Logging, that was a glorious day. That was a wonderful day to hear those words. Todd, I'm highly recommending that you're a candidate for iFuse.
It's basically a very small incision. The muscles are divided through to get down to the SI joint, and with the SI bone grafts, there's 3 grafts that are placed across that SI joint in a minimally invasive manner to allow that joint to fuse. The joint's fused by the bone growing onto those grafts over time.
I'm sitting here today, 19 weeks post-op, a new creature in a new body, and I actually have gotten myself back to doing all the things that I wanted to do. I'm starting playing tennis again. I'm starting to hit the golf ball. I'm fishing out of a boat without pain. I'm actually playing tennis again. I'm serving. I'm playing ping pong. I'm doing anything I want to do with my children. Just my life is back. I never dreamed that I would get that this day would come again. I never dreamed that I'd get my life back physically.
Just like Mr. Hicks' case, you know, sometimes it's easy to lose hope that there may not be an option for you and you may have to live with that pain, but if you truly, suffer from SI joint problems and pain, there are options that can help alleviate that and can take that pain away and hopefully get you back to a lifestyle not having to deal with it.
This iFuse changed my life. iFuse changed my life. I mean, it gave me my life back. And so I could go run across this cove right here, just down the road. I mean, it's just amazing.
So if you see this story and it resonates with you and this is kind of the things you're experiencing, we'd love to see you in the office, have you come in, let us examine you, determine whether this is something that may be an option for you and could hopefully get you relief.